My name is Hanis Nabilah.
My name is Shafina binti Samelan.
My name is Aida Nazalisya binti Kasim.
My name is Nur Adawiyah binti Mohd Salleh.
I am Siti Nor Sakinah from AS 114482.
My name is Nurul Hafizah binti Izhar.
In the 1980 and early 1990, the outbreak of HIV and AIDS swept across the United States and the rest of the world, although the disease originated decades earlier. Today, more than 70 million people have been affected with HIV and 35 million people have been died because of AIDS since the start of the pandemic, according to the World Health Organization (WHO). Researchers believe the first transmission of SIV to HIV in humans that then leads to the global pandemic occurred in 1920 in Kinshasa, the largest city in the Democratic Republic of Congo. The virus may have spread from Kinshasa along infrastructure roads such as roads, railways and rivers via migrants and the sad streets. In the 1960s, HIV spread from Africa to Haiti and the Caribbean when Haitian professionals in the colonial Democratic Republic of Congo returned home. The virus then moved from Caribbean to New York City around 1970 and then to San Francisco later in the decades. International travel from United States helped the virus spread across the rest of the globe.
First, you need to know that HIV is not the same as AIDS because HIV is the virus that leads to AIDS. Second, HIV came from chimp. HIV originated with Human Immunodeficiency Viruses, SIV, which come from chimpanzees and monkeys. For global HIV statistic, about 26 million people were accessing antiretroviral therapy as of the end of June 2020. In 2019, about 38 million people globally were living with HIV, and 36.2 million people of them were adults and 1.8 million people were children. Besides, 1.7 million people have become newly infected with HIV and 690,000 people have died from AIDS. 75.7 million people have become infected with HIV and 32.7 million people died from HIV. For your information, 81% of people living with HIV knew their HIV status, but 7.1 million people did not know that they were living with HIV.
HIV can spread through sexual contact or blood, for example by using a contaminated injection needle or from a mother to child during pregnancy, childbirth or breastfeeding. HIV cannot spread through ordinary contact, for example by hugging, kissing or shaking hands with someone who has the infection. There are three several symptoms of HIV, but not everyone will have the same symptoms. It depends on the person and what stage of the disease they are in. There are three stages of HIV. Acute HIV infection is the earliest stage of HIV infection. Within 2 to 4 weeks after infection, some people have flu-like symptoms such as fever, chills or headache for a couple of days. The second stage is chronic HIV infection, also called as asymptomatic HIV infection or clinical latency, which is during this stage, HIV still multiplies but at very low levels. The infected people may not feel sick or have any symptoms. People can stay in this stage for around 10 or 15 years. AIDS, acute immunodeficiency syndrome, is the final and most severe stage of HIV infection. The symptoms of which are seen in the form of TB, incessant coughing, and many more. Another signs are rapid weight loss, unabated fever, diarrhea, skin rashes, pneumonia, or swollen lymph glands.
AIDS is caused by the suppression of the immune system by the virus. The virus infects the helper T cells, specifically the CD4 cells. These cells then lose their fighting capacity. As a result, the body is unable to fight mild infections which are otherwise easy for the body to get over with. This produces a situation in which the body becomes immunodeficient. The body's immune system is unable to put up a fight against any foreign agents. The variety of symptoms that are produced as a result of this immune deficiency is called a syndrome, hence the name AIDS. Getting infected by the virus and having the symptoms of AIDS do not occur simultaneously. Sometimes a person who is infected by the virus remains fit for the whole life without ever having the symptoms of AIDS, while in some cases the incidence of infection and pronounced symptoms might appear within a time period of 1 week to 10 years.
So, mentioned government initiated anti-AIDS campaign use few tactics such as public campaign that have recently been revised to employ a softer approach, minimizing few tactics and referring to transmission risk as high-risk behavior. For example, its harm reduction measures such as condom restriction remain limited to specific target group, such as people already infected with HIV or AIDS. Lastly, Malaysia also made a program which is needle and syringe exchange program. This program remains on the front of line harm reduction approach to reduce HIV vulnerability among people who inject drugs. It introduced by the Ministry of Health in partnership with the Malaysia AIDS Council in 2006. The NSEP broke new grounds in providing direct community-based healthcare service for people who inject drugs nationwide.
Up until now, there are no effective cure for HIV. However, with proper medical care, HIV can be controlled. The main purpose of HIV treatment is to reduce the patient viral load to an undetectable level. The treatment for HIV is known as antiretroviral therapy, ART. ART is the combination of 3 or more medication from several different classes of drugs. The 3 medication will be combined in one pill and should be taken once daily. The classes of anti-HIV drugs are non-nucleoside reverse transcriptase inhibitors, nucleoside or nucleotide reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, and lastly, entry of fusion inhibitors. This treatment works by reducing the amount of HIV in the blood, also known as viral load. The medication of ART will help keep the viral load low and CD4 cells count high. The low viral load is known as viral suppression. Viral suppression is having less than 200 copies of HIV per milliliter of blood. Having less HIV means there are chances for immune system to recover and produce more CD4 cells. This will make the immune system strong enough to fight infection.